A staggering 70% of medical errors are linked to stress and burnout. So this is an epidemic that's becoming more and more important for doctors to address and determine how they're going to not only survive, but thrive in this new normal. We need to understand specific strategies to alleviate these stressors, right, when it comes to medical practices so that you can have the keys to be successful. Feeling overwhelmed by the daily stresses in your medical practice? You're not alone. Did you know that over 50% of doctors experience burnout in their careers? Your peaceful medical practice starts here. Learn the surprising keys you've been missing. I have an amazing story to tell about medical practices that I have worked with over the years. I have one in common that I bring up again and again. There is a practice I knew that was suffering pretty bad, especially during a pandemic. They had to close shop. They couldn't see their patients. Matter of fact, the doctor I knew even had to go out of the country for a couple of months in order to recoup revenue and do different things until he could come back into the States. It was a terrible time. Even after he came back and after the pandemic was over, this doctor was a pulmonologist in middle Georgia, struggled mightily to kind of get his practice to where he wanted to be. Can you imagine the stress that was on that practice and under that doctor as he strived to grow his medical practice over the last couple of years? This is not uncommon to a lot of medical practices, right? They're struggling not only how to maneuver things after the pandemic, but understand exactly how to grow their medical practice when you're faced with tons of regulations that are coming your way that's preventing you to do the thing that you love to do, which is see patients. So these are common to multiple practices. Did you know that a staggering 70% of medical errors are linked to stress and burnout? So this is an epidemic that's becoming more and more important for doctors to address and determine how they're going to not only survive, but thrive in this new normal. One of the things that we've seen is we need to understand specific strategies to alleviate these stressors, right, when it comes to medical practices so that you can have the keys to be successful. Today, we're going to tackle daily frustrations you face in your medical practice. We're going to uncover the common stressors that you would face on an ongoing basis to maintain things. And then finally, we're going to give you some actionable steps for stress management and explain how these tips can apply to various specialties. But we need to ask, what exactly makes a medical practice stressful in the first place? Well, let's talk about point number one, identifying common frustrations in medical practices. From dealing with difficult patients to endless paperwork, let's uncover these common stressors that you face daily. First of all, did you know that one of these things that can cause common frustrations are things like insurance issues? We talked about this previous on this channel about the recent Change Healthcare hack. Insurance issues are becoming more and more deal breaker for a lot of medical practices, right? You've always dealt with this, but even more so lately when it comes to dealing with multiple issues that comes to insurance, from whether it's billing things correctly, getting denials and trying to sort through all that, to maybe having things not work the way you want and having to switch insurers. This is something that's common to a lot of medical practices, and that stress, just running the business side of it, can be extremely stressful for a lot of medical practice. Second, you have high patient volumes. It's not unheard of for medical practices and doctors to see anywhere to 15 to 20 patients a day, 15-minute sessions, barely enough time for lunch, barely enough time to get into the office, because it's a volume game. Unfortunately, it's fee for service. So every time you see a patient, you do charge a fee. And this can be a lot of stress on a practitioner or doctor trying to maintain that. Even if you're an employee, a practitioner that's an employee, that's even more stress on you, because guess what? You're going to be held and be accountable for numbers that you have to maintain. And last but not least, time management. We discussed how do you manage and juggle all the different ways to treat your patients, get the latest learnings and understandings, keep up your CEUs, your credits, so for education, and understand new methods and ways to treat your patients better. This is a lot, not only to mention how do you manage your day-to-day life. This can be a lot on a medical practice owner and how you can manage all that. So this is some of the things that we've seen common time and time again. For instance, I know a medical practitioner, cardiologist, that was struggling mightily. The way he found this out when it came to insurance was that every year would go take a vacation, right? Practice would be there. We have his mid-levels take over the practice and see the patients, but he was struggling mightily because he found out that one year he decided not to travel successful during December and stayed in the practice. So he was seeing patients and they had a good volume. But he found out he was making the same amount of revenue that he was as if he was never there. To him, that really was critical. So if I'm here, I'm making the same amount of money as when I'm not here, then what's really going on with my revenue and my reimbursements? And that uncovered a whole host of other things when we had to understand exactly how to unpack his revenue cycle management, unpack his billing issues, unpack how he was managing his practice. So those are lessons in understanding. You have to identify important stressors as a first step in managing effectively. Now that we know some of the problems that can arise up, what can we do about them? Well, this gets into point two. Have you ever wondered how many doctors manage to stay calm and composed even on the busiest days? We've seen this being extremely successful. I had a client, primary care practitioner, who was recently going through a lot of stresses when it comes to dealing with insurers. He was not getting paid as he should. There was a lot of uncovering. One of the things that he really backed into was like, look, this has happened before. He told his practice administrator, he told his staff, look, healthcare is undergoing tremendous change, and having the right mindset to maneuver through all the changes and ups and downs will help us get through this part as well. And that calmed the rest of the staff down, has been able to ride the storm that they're currently facing. And I think this is really important. If you have a good understanding, it's called having an expansion mindset, right? Instead of a scarcity one. And it's just one of just looking at opportunities and focus on the positive instead of the negative. I know it sounds very simple, but that's a way to kind of alleviate a lot of stressors. Typically, anxiety comes from fears and concerns that are imagined, that are not really real. And what we imagine can be way worse than what's actually in front of us. But when you confront the hard truth and say, hey, we've been through this before, I can get through this, and focus on the positive things that are happening, you can alleviate a lot of stress that can bear down on a practitioner on a daily basis. So it is shown that doctors using these stress management techniques experience 30% less burnout. And that's totally clear in the studies, and more importantly, in how you kind of manage your practices. Some other actionable tips looking at mindfulness techniques and understanding calm exercises to clear your mind, making sure you have a manageable day. Maybe some days you don't see many patients, right? So you have time to reflect and think. Another thing is delegation, making sure you have the right staff members involved. You may have a practice manager, but you may need a practice administrator, someone just a little bit more advanced that understands the administration of the entire practice and how you run your profit and loss scenarios. You want to make sure you have efficient time management, right? If your setting is to see patients 15 minutes at a time, making sure you meet that qualification, but make sure you have buffer in between. So not 5-minute buffer, but 10, 15, 20-minute buffer so that you have enough time to prep, read the case, and prepare for your patient. Also, you want to make sure you set boundaries. If you're off the clock at a certain time, be off the clock. If your patients are constantly calling you at all hours, we understand that's very important, but maybe you set certain boundaries around that. Maybe a certain day a weekend, maybe Sunday night, maybe Saturday night, you don't take any calls, and you make sure you have your mid-levels take those calls. Making sure you set boundaries give you space to recharge, because that's so important, because if you don't, you run into constant stresses that hinder your growth, and more importantly, will hinder you and get you closer and closer to burnout, which is what you want to evolve. Because as you can see, those can be things that can move the needle away from the progress that you want to see in your practice over time. But what about the unique challenges that face in different medical practices, right? So that gets into our next strategy. How do you think about this when it comes to different medical practice? So whether you're in general practice, surgery, having tailored strategies can make a world of difference. Specific things around understanding your primary care, really about being a quarterback. How do you manage that quarterbacking of having your patients see different specialties and scheduling that, making sure you have a staff that understands that process so it doesn't always rely on you and overburden you and your staff. If you're a cardiologist, for instance, you have a lot of procedures that you have to do that are more intense. So making sure you have the latest techniques, understanding, so you don't become overwhelmed of the techniques and the procedures that you have to implement at scale with some of your patient population. Making sure you have staff members that understand it and prep properly, so you're not walking in not having everything you need in order to provide the best services. If you're a pulmonologist, you may want to look at if you're running different sleep labs or sleep studies. You want to make sure you have that process set up and have a team member that you can delegate to that runs a lot of that, right? If you're in nephrology and you work with a lot of dialysis patients, you want to make sure you have staff members that can go see the patients in your stead when you make the rounds, right? To make sure patients are doing well during dialysis. So making sure you have structures in place, policies in place, and people in place in order to managed properly will make you way more successful and manage the stress that can kind of come on a daily basis. Finally, you want to think about tailoring and understanding where you are in your practice, goals you want to set for. You want to prepare for that properly and having strategies around that. Look, you may be asking, well, who's behind these strategies? How do we know that they're going to work? I can tell you, as someone who has worked with hundreds of medical practice owners, we have seen the successes. We've been working with medical practice owners since before 2015. We've seen the transition in healthcare, right, from paper and pen to medical records, right, digitizing them, understanding patient engagement tools through the pandemic, understanding value-based care. So we've seen how healthcare has changed in the last 20 years drastically, right? And we understand the stresses that come to them. But more importantly, because we've seen so many cases, we see ways to help the practitioners, the doctors, the healthcare professionals who are struggling mightily to kind of maneuver through all this, right? Because that is something they struggle with consistently. One of the things also helps us is because we have clinical team members that understand things like motivational interviewing, understand how to communicate. We have staff that understand mental health and understand how to help patients, but more importantly, our staff members, how to maneuver through different stressors, right? Because we as a company that deals with digital health and technologies and tools need to have ways to manage stress as well. And so having internal processes to kind of handle it ourselves, but also helping tons of practices through the daily frustration and stressing of the modern healthcare system has given us a lot of tool sets and understandings how we can be more sympathetic and help medical practices through these difficult times. So I think that's how you can start implementing these changes today, by going through some of the processes we discussed. So what I want to say is, like, we covered a lot of ground. So what's the next steps for you to think through this process? Well, like we said, we covered several key that you can take with you to move forward. First off, you want to uncover common stressors that you're facing. We also gave you actionable tips for stress management that you can use today. And then we also explained how these tips can work within various specialties and how you can implement them today. Ultimately, it's really about you starting with these processes, and then start small by just implementing one of these strategies in order to maximize what you're trying to achieve. I think if you start small and seeing the results from that, and again, like we talked about before, focusing on the positive results of the actions you're doing, you will see so many better results and will avoid burnout. It's really about inputs and outputs. Don't let the focus on the outcomes persuade you from what's happening on the outcomes. So you want to make sure you really understand that the outcomes are positive, and then if you change the inputs, you get better outcomes. And so really kind of focused on that, you'll be able to ensure that you're going to get a better scenario of how you can move forward. It's important that if you do this right, absolutely, we've seen that doctors who can manage their stress effectively see a 40% increase in patient satisfaction. And ultimately, that's what we're all in here for, to help the patients to get better and to do better over time. In addition to other resources, check out the American Medical Association resources on how doctors can avoid burnout. This will help you maneuver some of the different things, especially those who run independent physician groups. But also comment on your own experiences, right? And how you're looking to utilize some of these tools and sets that we discussed. And more importantly, please subscribe and follow us for more tips on managing your medical practices in this new normal.